So let's get 2 minutes on the clock for our first case tonight. Your time starts now. All right, 2 minutes is up. Sorry about that little technical glitch. Not entirely sure what happened there. We'll see if that happens on the next one. Let's go through some answers, of course. So here we're looking for, in particular, what are the specific features that contribute to the diagnosis based on her presentation. So 3 clinical features is irregular periods, irregular menses, metabolic features, or specifically difficulty in weight control. I think you're probably safer putting difficulty in weight control, and of course hirsutism, that excessive hair growth. Now, of course, we do have other features that are diagnostic. That would be that subfertility or infertility, psychological symptoms like anxiety, depression. But remember, here in this situation, they've specified based on her presentation. So they want you to pull out those criteria from the information given here. And so, as people have put in already, fantastic. It's that irregular period, signs of hirsutism, difficulty controlling weight. Absolutely smashed it. Well done. And again, Demir, fantastic. Very good. Remember, in the actual exam, I'm going to pick on you. Make sure you're actually spelling out body mass index. I know it sounds stupid, but we're avoiding those abbreviations and making sure we're not missing out on any marks. Absolutely nailed it though, guys. Well done. And, of course, we've got more questions. Let's put another 2 minutes on the clock, and your time starts now. All right, time is up. Great to see some answers coming through. And this is one of the situations where we, again, have more correct answers than the number of answers requested. So always remember that they're usually playing the ball in your court, giving you that opportunity to pick up marks by having more things that are right than you need to have there. But this does give them the ability to then actually weight some of those answers to be more specific to the condition. So probably the best marks here are going to be, as most of you put up here, the A and B, so your serum free androgen index, which we would expect to be elevated. Likewise, we would expect to have an elevated luteinizing hormone, and we would also potentially check the follicle stimulating hormone as well in there to look at the LH-FSH ratio, which would be up. Now, those biochemical markers are going to be more sensitive and more specific towards polycystic ovarian syndrome. Of course, you would also be looking for random blood glucose to check for those metabolic disturbances and the pelvic ultrasound for those polycystic ovaries. Fancy that. Now, why would pelvic ultrasound be worth less marks in this setting than those biochemical markers? That's going to be because, don't forget, up to 70% of young women are potentially going to have polycystic ovaries on ultrasound. Likewise, it's not reliable for the diagnosis of it. So a lot of people with polycystic ovarian syndrome don't have polycystic ovaries. And so you're better off using some of those other criteria that are going to be that little bit more specific. It's the trouble when it's named after something that may not always be the case. So again, Demir, fantastic responses there. You're still going to do very well in those responses. Likewise, Dr. Saranya. There is a note here as well, of course, that the LH levels might depend on the phase of cycle. Yes, this is true. Levels will go up and down, but you would still expect overall them to be significantly more elevated than you would in someone without polycystic ovarian syndrome. And so if I had to put the bet between am I more likely to see elevated LH levels or cysts on ultrasound, I'd probably actually still go for the LH level. Hopefully that makes sense. All right. Now, other things that you would be considering in a case like this would be things like checking your thyroid's stimulating hormone. Again, we've got those changes to hair growth. It'd be something we'd be keeping in the back of our mind. You'd also be potentially looking at prolactin levels. The reason why they wouldn't be as applicable in this case here is that, again, the stem of the question here is what tests would be appropriate to confirm the diagnosis of PCOS. And so those other responses are going to be more excluding other conditions than they are confirming the PCOS, thus wouldn't get you the marks in this case. In clinical practice, you'd still be doing those tests, but be aware that these questions are going to really specify down what is the information they're trying to get, so tailor your answers to that. All right, of course we've got another question up here, so let's get 2 minutes on the clock and your time starts now. All right, time is up, and let's have a look what the answers are. Now, there are new guidelines out for last year to go through the international evidence-based recommendations for managing patients and assessing them with polycystic ovarian syndrome. This is something that don't spend too much time reading before the exam, please. It's a big document, but it is something that I think for clinical practice would definitely be worth having a look at. Now, really happy to see some of those answers come through because you've absolutely nailed it there in terms of how important it is to make sure that there is a proper diet in place and trying to really maintain that healthy weight. So how do we do that? The standard things that you're going to be expected to put out there is going to be regular exercise, 30 minutes a day, at least 5 days per week. That can be expressed as sessional events, or in the guidelines there it also specifies weekly cumulative as well. So I think as long as you're acknowledging some form of exercise there, of physical activity, with a regime that is sensible for that patient, you're going to get those full marks there. And again, being a priority, it's going to be weighted more points. That's what I'm trying to say. Now, balanced and nutritious diet, but emphasizing a caloric restriction. You want to be on the lower end of caloric intake to manage that diet. And again, as long as you're acknowledging the diet there, you should get those marks. Probably grouped together would be referral to dietitian for meal plans, because essentially those two things are aiming to accomplish the same target. Specifying a healthy weight range to be aiming for is also important. This is a patient that's not dramatically outside those ranges, which is good. And so as long as they're under the 27 mark, you're going to be getting marks there. Of course, if you can bring that down to even 25, it would be even better. But as long as you can get it, the evidence really is saying to try and get that under 27 shows the greatest metabolic improvements. Not necessarily applicable right now, but we also know that, again, keeping the BMI reduced also has massive implications in fertility. And that's also something that I'll be raising to this patient that down the line. That is something that we would also be talking about, given the obvious implications for PCOS and subfertility or infertility. Now, something that, truth be told, I wasn't actually aware of is the importance of getting proper sleep with PCOS. Patients that achieve at least 7 to 8 hours per night do markedly better in metabolic profile and regulation of cycle than patients that don't. So again, good marks there. And of course, acknowledging the psychological impact that this is going to have, so cognitive behavioural therapy or referral to psychologist for psychological support. And again, even if you specify cognitive behavioural therapy, I'd be adding into there that for psychological support to specify you're doing something, but why you're doing it. Of course, we are then also talking about symptom management, and so laser or electrolysis for hair removal for hirsutism management is definitely going to get you marks. So we've got the referral to a dietitian to help choose appropriate low-caloric diet. Fantastic. Regular moderate intensity exercise 5 times a week, 30 minutes per day. Absolutely beautiful. Referral to dietitian for Mediterranean diet. And yes, there's evidence for Mediterranean diet in this setting, and 30 minutes of moderate intensity exercise daily. Fantastic. Facial hair removal at salon. Yeah. I think it's fair that it may not be our area of expertise, but saying, hey, there's salons that can do that, I'd be giving you full marks if that was me.